Hi, Matthew Holt with the TCB Spotlight, and we are talking with Fawad Butt and Missy Krasner from the new-ish AI company called PenguinAI, which for all the AI companies out there probably has the benefit of having the nicest names. It's named after a small, cute little bird that can't fly. All right, real quick, who's who. Fawad has had a long time career at United Optum, the big evil company, and then the nice cuddly nonprofit Kaiser, where he was doing AI and digital stuff. Missy is a very old friend of mine who has been hanging out since the David Brailer days at when the Republicans were sensible-ish. Which is a long time ago, at ONC as it was then, or ASTP as it is now, but has then gone through Google and Box and Amazon and did a whole thing at Redesign doing founding, and somehow at the end of all that has now become a co-founder of this company too. All right, so let's start with the basics. Clearly, there aren't enough companies calling themselves something AI. You guys just raised an A round of 29 odd million, but you've been doing a little bit for a while at this stage. Fawad, what the hell do you guys do? And give me a flavor of what you think the problem is that you're trying to solve.
Yeah, look, I think, first of all, thank you for the opportunity. Looking forward to this conversation. I think we just figured there weren't enough AI companies out there, so we should start one. And why not choose a flightless bird that as the company name? Look, despite the cuteness on the name, I think we're here to solve a big and real problem in healthcare. As most of us are quite aware, the technology in healthcare today is about a generation old. We've put a lot of lipstick on this thing. We took junk that used to be on the mainframes and we brought it to data warehouses, and we took those data warehouses and took them to the cloud, and then we bought a bunch of SaaS stuff, and then there was this whole mobile revolution. All that's been great, but nothing's foundationally, structurally changed in healthcare. The underpinning and the technology is pretty much the same. The skin and the front ends have evolved a lot. As we sort of look at this point in time, I do firmly believe that there's an inflection point in the industry. There is a new capability that's available today that we just never had before with generative AI and agents. So the premise of the company is as follows. If we believe that the world is moving towards an agentic architecture, and we also believe that healthcare or agentic healthcare is inevitable at this point, then ultimately, if you're a CIO, CEO, CDO, CAO, one of the C combinations of soup out there, the question you're asking yourself is, holy cow, I got to build 1,000 agents to modernize my operations. What's the platform and the technology that I'm going to use to enable that transformation? And so PenguinAI, in the simplest way, has built a platform so you can deploy some out-of-the-box agents that we provide, but ultimately be able to build and deploy agents across the enterprise. We're built just for healthcare. I can't say that enough. So we're not an Azure. We're not a GCP. We're not a AWS, where we're building horizontal technologies and then taking it to various industries and asking them to adopt to it. We built this platform ground up to just solve for healthcare problems. This is my background. This is the work I've done at all of the big names that you mentioned earlier. But that responsibility and that experience we're bringing into PenguinAI and building a foundational layer and a platform on top of which you can build all the agents and deploy all the agents necessary within healthcare, with the privacy, with the compliance, with the security, with the governance, with the connectivity to your ecosystem. So that's who we are, and that's why we're, while we have a funny name, we have a big charter.
All right, Missy, why were you I mean, the amount of companies you have founded, worked out over the last decade is a lot. Why are you so impressed and excited about this one?
Yeah, I mean, the origin story for how Fawad and I started working together was I knew Fawad when I was just a little baby when I took over the box right before we went public.
You weren't a baby, was
okay, well, we don't need to call my age out, Matthew.
I'm not saying you were.
Come on now.
You were a senior citizen collecting Social Security. But
I know I'm old. We're all the ARP of healthcare. But
I'm getting there very soon. Sooner than you two.
yeah, but basically that was like more than a decade and a half ago when I was leading the healthcare and life sciences P&L at Box, and we had sold a large deployment into Kaiser Permanente, and Fawad, had like 500 people in his org, or more like 5,000. And I had the sort of privilege of making him come to dinner at Redwood City and having Aaron Levy shake his hand to just thank him for his business. And that was the first time I laid eyes on him. And then, he moved over to United and then had some big jobs over at Optum. And it wasn't until he left those big jobs and ended up at Canvas Ventures, which I used to work at with Rebecca Lynn. You remember the days when we held the PT to VC contest.
I still remember the only wise investment in digital health ever. You and Rebecca.
Super fun back then with you.
Which you overpaid by a factor of
yes, we did. We did. But yeah, so Fawad came in after, being a chief data officer at three of the largest healthcare organizations, and sort of had to sit on the sidelines for about a year to outlast some of his non-competes. And so doing something sort of safe in the money world. So he joined Canvas right as I was exiting out. And we started chatting about what my experience was there when I was doing Practice Fusion with Rebecca and Doximity, and what he then did, 7 companies later. And then I was at Redesign, and I said, hey, Fawad, Redesign needs someone with a sort of the technology prowess and the sort of luminary vision that you have, because we're doing a lot of tech-enabled services, but we want to go deeper into tech. So Fawad sat on our board, our executive advisory board, and helped us think about specifically payer tech and a lot of things in credentialing. And he was in a value-based care company with me. And so as he was working his way through venture and did 3 or 4 years there, OpenAI came on, ChatGPT came on the scene. And it was exactly 2 years ago at JP Morgan where he said, let's grab a drink. I'm thinking of getting a company going here, because this is something we can do that we've never done before with this technology. This is going to solve a lot of the problems that I had been trying to solve with my teams. And I have a bench of like a whole bunch of AI, traditional AI, ML, and data science experts that worked for me at United that are willing to follow me. And I think it's now time to start a company. 0 to 10 from all your time at Redesign. You're exiting Redesign. Do you want to jump in and help me get this company in market? And that's how this alliance formed. And I've been essentially on the ride for the last 2 years, watching Fawad do his magic, essentially getting this full enterprise grade platform built, getting our first customers, raising our seed round, and now all the way to our Series A. It's just been wonderful to watch his sort of leadership and some of his vision. And I will say this, and Fawad jump in, I would say, gosh, 2 years ago when you had this platform concept, right? That's what I was really attracted to. I was like, hey, I'm going to learn about a bunch about AI. It's like getting an MBA in AI from Fawad, right? But at the same time, he was staunch on his vision, which was it's platform over point solutions. I'm not doing another Gen AI wrapper company, which just is a bolt-on of workflow to sort of like these large language models that are commercial. I do not believe in that. I trained a ton of other horizontal tech on healthcare. I'm not going to do that again. I know exactly what I need to build because I've been in that buyer seat. And that's what convinced me this is the place that I should spend time. This is the place that I should bet on, and betting just on his vision as well. I mean, Fawad, you can say how many doors we got slammed, and those
so I came from venture world, at Canvas for a couple of years. And then prior to that, I had helped a lot of venture firms, Matthew, due diligence across the industry on data technologies, on governance technologies, on observability, all the things that happened a decade before I'd been involved. So I thought I had friends in venture. So I knew people. And then when we started to sort of pitch the idea for PenguinAI, and it was a grand vision of building the platform that all other capabilities that we need to transform are sit on top of, we were shunned. Like somebody I've made $1 billion, somebody that I think I have contributed $1 billion in their funds returns based on the advice I've given them, essentially told me I was an idiot for doing it, right? So why don't you just go build a prior auth company and generate $100 million in ARR or pick one?
So let me interrupt you. I think I know why they called you an idiot. It's a bit harsh than called an idiot, but and I've written a piece about this, which is why I think it's very hard to buy and sell AI, which is that you don't know the capabilities that the underlying LLMs are going to develop with, and you don't know which verticals they're going to go into. We do know that our old friend Nate just moved from Doximity and is now hanging out at this place called OpenAI, which seems to have some street cred in the world of AI. And are they going to be built? Who the hell knows what they're going to be building? But the concept of doing agentic work, which you're hearing about from those LLMs, is coming for sure, if not already here. Then you have some large vendors in the current incumbents. There's one in Wisconsin you may have heard of, but now saying, we're doing all the AI stuff, you don't worry about that. And then you have, as you said, a bunch of what you call point solutions who've raised a ton of money. Starting with the Scribes, but a bunch of others as well, who are now doing essentially, and your friends at General Catalyst have put God knows how many gazillions into Cumura at this stage who are doing whatever you want.
One of these days it's going to make it.
Deploying engineers, they're palantired. And I would, as a buyer, and before I'd go back to when you were a buyer, that to me looks very confusing because I'm not sure if you're going to make a big bet, which one you should be betting on. And I might just be hanging out and waiting and seeing what I can do with my own resources because it's not really clear that there is a barrier that one person is now doing, I don't know, chronic care and somebody else over here is doing utilization management. And there were boxes before that you could draw in a chart, and now it's this messy blob. So I love the idea that you'd want to be the massive underlying platform that does everything, but why would somebody believe you?
Well, look, I think stepping back a little bit, so I've talked to 100+ CIOs, CXOs over the last year alone, right? As you can imagine, we engage with a lot of potential customers. We also had a lot of VCs have us talk to some of their partners and so forth. So we've gone out there. The most common look I see, if you peel the layers, right? All these CXOs sit very prestigiously at these tables and have a very, very robust demeanor. But the most common look that I see is called deer in headlights.
Sure.
It's the confusion. You peel the layer, they're freaked the hell out underneath it, right? Because everybody's coming at you. Your board is saying you're not doing enough. Your CEO is sending you news stories of your competitors doing stuff. Your business teams all have a solution that they've identified that somebody's pitched to them that they want to implement. And then ultimately, all this demand that's coming to you requires you to have talent that you have no business or ability to acquire because Zuckerberg's sending WhatsApp messages to people.
I hear a lot of people who join Zuckerberg quit 2 days later, so you can hire them. They've already got their 120 million.
Yeah, but the game has changed though, Matthew, right? By that one WhatsApp message that Zuck sent out to the first candidate, he changed the game. And so we all have to play in this new arena. Whether you're United or Elevance or one of the Blue Cross Blue Shield plans or a hospital system, you all have to play here. So there is epic confusion, pun intended, there. And yes, the Epic did come up a couple of weeks ago and sort of outline their roadmap. And if you look at it, it seems like they're going to boil the entire ocean all by themselves. And as somebody, or all of us that have been in this industry, and as somebody that was at the largest Epic customer in the world, managing data going in and out of that system, I can assure you that I've seen a lot of roadmaps. I can assure you that signaling is a lot easier to do than to build product. And I can assure you that when you become a large enterprise with hundreds of customers on the software side, you have legacy debt that you have to contend with before you build anything new. So while I would not doubt Epic's ability to sprint, I do know the reality on the ground very much as well. So if you're a CIO, and we had a conversation with one yesterday, a CXO, and if your approach is that I'm going to wait for Epic, good for you. God bless you. I wish you nothing but the best. I hope your business still exists in 36 to 48 months. Financially is solvent by the time these large companies deliver this value. So you don't actually have the optionality that you think you do as a CXO. You think you can wait and figure this out. But the reality is that the business environment has shifted. right? Look at what's happened at United. A CEO got replaced. Stock went to half. Look at what happened in Elevance and CVS stock over the last 18 months. The writing is on the wall. The 4% to 6% margin environment after paying for MLR and operating costs is gone. Now you're in a negative 4% margin environment. And the only way you get to survive is to create efficiency in your workflows this year, not 3 years from now. So I've been in all three chairs. I've been in the buyer chair, I've been in the investor chair, and now I'm in the founder chair. I can assure you that the urgency isn't just on the investment side and the founder side. It is also on the buyer side.
Just what I would say is we started 2 years ago, like we officially kind of incorporated in 2024 and like sort of that February, March timeframe. And I would say for like 4 or 5 months, we were out pitching the platform vision with a fully built enterprise grade solution. This company did something very different. This company has such a deep bench of talent, and it's got a huge engineering and data science bench. So product was built, and we had to go out and test the market and figure out how to sell it. The market was super nascent, and it's still evolving. The buyers were like very interested in AI pilots and figuring out administratively what some of those low-hanging fruit use cases were beyond just scribing or in-basket management that a lot of the EHRs and some of the larger scribing companies were doing. And so what we were trying to figure out in that first sort of 7 to 8 months when all the VCs were like, oh, you're too haughty. You think that you can create a platform. What platforms in healthcare have succeeded? Give me one example. And they would, they'd call out Innovaccer or maybe
Healthion.
Yeah, right. Healthcare.
Wait. That's the one from the archives for the youngsters.
There you go. That's for us.
Look that one up.
But I mean, the point here is that the market may be buying point solutions right now. They might be buying a Cohere, they might be buying a Navina, or a Tenor. But at some point, as the market evolves, do you want 8 or 9 of those point solutions, or do you want to be thinking about all the things around AI and model drift and compliance and governance, and with a platform that has connectors out to data, that can de-identify that data, that can do synthetic data creation if needed? There's a whole bunch of things that the enterprise has to think about rather than just, I need a solution or a prior auth solution, or I need HCC coding, or I need medical coding, whatever it is. And it's not to say that any of those point solutions are going to be disbanded or they're not going to grow horizontally. It's just that because we have platform capabilities, the land and expand enterprise sell is generally where I think Fawad being in the buyer seat and talking to other buyers is essentially credible. And that's where I think now, fast forward a year and a half later, our Series A went fast because now there are people investing in the platform concept. There's 3 or 4 other platform players out there, or at least they're walking the platform walk. They've got some language. I don't think they have the tooling yet. And that's what I think is the change in the market. I mean, Fawad, we watched this happen in front of our own eyes, right?
Look, we went from you're idiots for wanting to do something this broad, and yes, sure, you may be able to say you've done this at large enterprises before, but you never built a company that can do this from ground up. You're an idiot. To, oh my God, we've always had a thesis on platform. It literally turned in one.
How many former Olive clients were you talking to with this guy?
So look, there are companies out there that have sullied the healthcare platform market, right? And you name some of those already, not just one, but more than one. and it seems like they're all being funded by the same VC firm too. But
I assume your B round is not being led by Hemant in that case. After that comment,
look, I love VCs that enable and support our industry, and I think Hemant is one of those. So nothing but mad respect for him. But at the same time, we have to live in the world of reality and recognize when things didn't succeed, and then learn from them as to why they didn't succeed, instead of just sort of putting another coat of wash on it and calling it, mission accomplished.
All right. So let's say I accept your argument. You need a cross-enterprise platform that can do everything, can put its tentacles everywhere, and you can build the applications on the top of. And that, go back to Judy Fulton's grand vision. That's basically what she built for providers, right? There's a second set of questions. You mentioned a couple of customers. You got in the press release. You didn't have customers, but you have Blues of New Jersey, Horizon, and UPMC on the docket. One of them, I believe, has some is a health insurance company. The other one has everything, including private jets. So, who do you think the customers are? Is it basically payers, or is it going to be everybody? You're going to be on both sides of what I used to call when I used to talk to Andy Slavitt when he was in Gen X. I said, "Oh, so you're an arms dealer because you're selling to both sides."
So I use that word, and my PR team keeps telling me not to use that word, but I am the arms dealer in the agentic healthcare space. Okay, so look at me, remember my face, know my company. If you're going to play in this space, you need to come talk to me.
Freddie Mercury will write a song about you soon enough.
Yeah, that's probably true.
Remember that obscure one from the Queen album, anyway.
Yeah. So look at it's been kind of interesting to see the progression, to be honest, because the markets evolve so quickly, and we've seen the buyers go from sort of being suspicious of this AI thing to wanting to try it, to knocking down the doors to saying, what else can you do? So it's really just happened, I would say, in the last 12 months, mostly. What we see is an opportunity both on the payer and the provider side. And I think it's a false separation between the two sides, because processes either start on one and end on the other, or vice versa. So what we saw, Matthew, was that earlier part of this year, I would say January, February, March timeframe, the provider side of the house was extremely active and open to doing the pilots and trying out the ideas. And we saw a number of customers come to us and get into quick, what we call proof of values, which tend to be about 90 days long on average. And most of those, with the exception of one where the CIO was left the company, so we had to rebuild the relationship, every one of those converted after the 90 or so days of POVs, because we could show the ROI, we could show the value. So the providers actually ended up adopting a lot quicker. The payers we're talking to actually from last quarter 4 of last year, and what we saw with them was they had to get their strategy in place. They had to hire their talent teams. They had to get the budgets approved from their committees. They had to get McKinsey or Deloitte or Accenture to come and do an assessment. So they were kind of going through that process, but that shifted, I would say, in Q2 of 2025, where the payers started to show the same acceleration that we saw from the provider side in the earlier part of the year. So we're seeing the payers catch up. And I think part of the reason that's happening, there's the urgency there, is because the providers have deployed the agents already, and they're appealing the hell out of every denial that the payer is sending them. And the payers are still using humans and data warehouses and old workflow tools to deal with the 100% appeals rates that are popping up. So there's an urgency on the payer side to catch up. One side has better weapons or agentic tools than the other does, and so everybody's got to catch up.
I mean, Matthew, Fawad has been saying that the agent wars are not coming, they're here between provider and payer. And, early on, we also got sort of laughed at because they were like, oh, you need ruthless focus. You're a startup. Why? How can you sell across payer and provider? I mean, Fawad's both a provider and payer guy. Kaiser was both. And, United Optum has thousands and thousands of providers that they've.
No, I saw a congressional committee where apparently there were hardly any.
Oh, yes. Yes, this is true. Hardly any at all.
Don't trust old British guys.
The point is that if you're looking at administrative processes, like we're not trying to be, Hippocratic. We're not trying to be a nurse. But if you're looking at sort of administrative processes, the workflow is similar. It just starts at different sides with provider and payer. So it is interesting. And just to be clear, those early provider customers have been agile customers. They've been, on the practice side, or they've been sort of large private equity backed home health. There's like a basket of what we've been able to sort of go fast and pilot with on the provider side. I think large academic medical centers, health systems, IDNs, they're still also trying to figure out
Yeah.
beyond what Epic and or Cerner may be feeding them and beyond just sort of some small stuff that they're doing on inbound faxing and comms, right? Marketing and comms. They're trying to figure out, hey, how do we govern here? How do we make sure that we're using AI? And
They're
so,
the most confused. I'm sorry to
yeah,
jump in, but I will just say that, when I say, there's a deer in headlight looks, I think the idea, the delivery networks, the care delivery organizations, especially the medium to larger size ones, are probably the most paralyzed right now.
So can you guys name some names on customers on both sides at the moment?
We will have announcements coming in the next 60 days or less.
Amandola's been teaching you well. You tell them about
Matt,
you go back and tell them about the product, then you tell them about the customers.
well,
Matt,
it's
I'm
also
an old dog. I'm an old dog. I've done this for a long time.
All right,
I got this training.
So let's go to the type of stuff. So there's two things going on now. You know perfectly well that when I'm dictator, we're going to have kings here. Apparently, I might as well be the next one because the
I think we might be there.
Current guy apparently has got God knows what and is about to drop off at any moment. We have this ridiculous fight, which you are now putting yourselves in the middle of, right? Which is over the 2% up or down. Now, there's two things going on, right? One is, can I deny? Can I bump your MLR up? Can you bump mine down? Yes, United stock price went down because they claimed to be able to manage care and they couldn't. I mean, Len Schaefer said he could manage care for WellPoint 20 years ago, and it was all bullshit then. So no one actually knows what's going on in the health of their groups. So there's a whole bunch of work going on there. So number one, that fight is kind of a silly fight, but it is obviously one that's attracting a ton of effort and a ton of attention and politics. And yes, there must be a bunch of admin waste attached to all of that, which I'm sure AI can get rid of. But once you've kind of done that and everyone's got their agentics going at each other about denials and claims and whatever, and comes to whatever conclusion they come to, where does this AI stuff really actually start moving the needle or making any of the stuff better?
Yeah, look, I think so. It's easy to get caught up in the technology and forget the human stories, right? So I don't tell this story. I don't think I've ever told this story in public, but I have a personal story that drove me to accelerate this work for me, right? I'm an immigrant. I came to the U.S. At 18.
Bloody immigrants coming to America. Really.
That's right, taking all your jobs. And I've taken a few. So look, I came here. I didn't you don't have a structure when you land here by yourself. So your friends and the network you build become your family. And I had a person like that in my life. His name was Alan, and Alan and I grew up together. Pretty much got married around the same time, had kids around the same time. And make a long story short, Alan was diagnosed with cancer. And Alan was a carpenter, ran his own small business, did a lot of carpentry work for homeowners as well as businesses. But I saw how he suffered through especially the last 30 days of his life when the doctors knew he wasn't going to make it. All he needed during that time, Matt, was a specialized bed that could be delivered to his house that he could rest in for the last 30 days of his life. And the administrative bullshit that took place between the patient, the payer, and the provider netted in the bed never showing up and Alan passing away on a lazy boy-like chair. Because that was the only place that could give him a moment of comfort when he was in that severe pain. So when we talk about this admin burden, this isn't just some dollars and cents and margin on a payer or a provider's balance sheet. This is people's lives that are impacted when a day or a week or a month goes by and you don't get the one thing that you need, and it is the point in time where you need it the most. So yeah, I think this is going to make an impact.
But I mean, Fawad, you know, I've heard the Allen story just privately, and I'm glad that you're sharing it here. You know, and I'll harken back to the first, you know, 2 years ago drink that we had when you're like, I'm doing this. Now's the time. I'm ready. I'm gonna be a first time founder. I've done everything else. And you said, this keeps me up at night. I was like, are you sure? Like this is like unsexy, you know, in the bowels of healthcare stuff. You sure you want to do this? This is the stuff that keeps me up at night. This will be my last contribution. This is where I want to make my mark. I want to solve this because I tried to solve it in my 3 other jobs. And you know, I mean, Matthew, I went away and I was like, I don't know if this stuff keeps me up at night, but I certainly want to help solve it. And my family's been impacted by it. But to your question, none of our pilots or proof of values, none of them are done without a list of ROI that we're trying to measure by the end of the 30, 60, 90-day time. And that's depending on if we're giving them a digital worker or an agent, or we're giving them, you know, they're importing some of their data in and we're helping them fine tune something, whatever it may be. It's generally around time savings. If it's medical coding, it's around like, you know, money saved per quarter. If it's around risk coding, I mean, there are specific things that we're trying to prove and show. And a lot of it has to do with speed to decision, right? On denials, it's which denials are you going to pursue at a higher rate, right? And all of those things kind of get care faster, right? It helps unburden the provider and unburden the patient. So we see the downside effect. But there are hard things that we're measuring. We will not convert a pilot without hitting those milestones. So there has to be some kind of lift, right? I mean,
and the lift we see is on clinical staff, right? That is, so payers employ a lot of clinical staff, just like providers employ a lot of clinical staff. This staff is primarily reviewing documents and making decisions based on the information submitted. So we do see one impact is that fewer clinicians can do more high quality work, so that some of those can be redeployed to actually coordination of care and other capabilities that are necessary. Because there's a dynamic tension. I was talking to a CEO of a health plan in the Blue Cross Blue Shield network, and he said, "Hey, I have a $38 million clinical cost on an annual basis." And I said, "How much clinical work are you doing with that? That's pretty substantial." And it's a regional plan in one state, and he said, 10% of that is actually going towards care coordination. 90% of that is being used to review claims, to review payments, to review prior auths. And that's it. Look, we have 960 or 70,000 active physicians in this country. And if we taking some of them and keep deploying them towards admin tasks, we're not doing ourselves any service.
Yeah. Look, I have the solution to that, which we'll have to wait till I'm king. But I've written that up. That we just give all the primary care doctors people with vouchers, and away we go. But what you say is true, right? We call it admin waste, but there is a ton of patient frustration. I mean, I wrote up this jokey thing when I was trying to get myself into, you know, I actually had a prior auth from Blue Shield, which I was just trying to get the damn referral done from primary care doc through to the cardiology clinic. You know, 3 calls, so I had to bring to emails sent, faxes, whatever, before I actually got through the gate and did it. And yeah, a ton of people would have given up. And in my case, if I'd given up, I wouldn't have found something that was quite bad. So, you know, I bet you that the admin stuff you're talking about does have real human impacts all over the place. Not to mention people who get denied care, which, you know, they through need and etc. So that, I mean, if the agentic stuff you're doing can clean that up, both on the waste side, you know, the waste emotion of the people who are on hold with you know, Humana's whatever line, I'm all for it. But are you going to stay in that world, or the more clinical world where you know you said, Missy, we're not going to go to the Hippocratic or ellipsis world,
but there are some more clinical use cases.
But are you gonna because in the end this stuff is all, you know, I'm in the middle of whatever. I would just give you an example. I got the result back that I got from my cardiology clinic, And look, I read it, and then I happen to have a client who's a senior cardiologist, so he read it. But I also gave it a chat GPT. But now Epic says they're going to come up with explanations that using AI. How far are you going to go on that path of like using the tools and the AI and the platform to help clinicians, help patients, deal with that understanding what's going on?
Look, I think, I would say we're starting with the administrative side just because there's $1 trillion plus there that could be easily improved. So I think, when there's a 20% of our spend is on the admin side, I think you start cleaning that up. It actually has downstream impacts on clinical outcomes, even though it's not clinical by itself. The second thing we're probably going to do is go clinically adjacent, right? Where there are lots of clinical information that is used to make decisions, but they're not clinical decisions, or they're not patient next best actions for patients. I think they're in support of a nurse. They're in support of a PA. They're in support of some of the other staff there. I think there's opportunity there. I don't have a conceptual issue going into clinical ultimately. The challenge I have, Matthew, is you got to be right 100% of the time when you're doing clinical, right? So the efficacy of the intelligence and the models you use has to be of highest quality. And if you ask me today, if the models that exist today, whether they're the large models, from one of the foundation labs or smaller models, I think it's tough to find a reasonable amount of accuracy in a consistent basis to be able to turn that on for actual patients. I do agree that people are going to ChatGPT independently, and so are the doctors, and they're putting a lot of this information in there. I just don't feel comfortable selling a solution today in September of 2025 that I feel a generative solution that I feel good about that could be used for purely clinical decision making. So that's kind of my stand.
The only thing that I'll add to that though is that Fawad puts tooling that a clinician may use to sort of, help be able to view the salient facts in a medical record, or even scribing, not that we're doing scribing, but scribing as well. Those are administrative in his bucket, right, in his mind, because they're essentially tools that are helping clinicians go faster, make decisions faster, service the patients better, versus a fully clinical use case like using AI to determine sepsis. Or there's a lot of fantastic AI companies out there, and our friends over at Hopper that are doing radiology and building foundation models in radiology. That's fully clinical and more diagnostic. I think there are definitely things, Fawad, that you and the team have that are in the bailiwick of what you would call administrative, that are much more closer to the clinician and the clinical user, as opposed to someone who's just in a call center or working claims. Right?
Correct. I think there are lots of things we can do to enable clinicians. I just don't think we are ready to replace or augment clinicians using the current generative technology. Maybe that'll evolve in 18, 24, 36 months, and then we'll have a different conversation. But I live in the world that we are today, and I think I'm more comfortable being in the support of clinicians and capacity for clinicians versus augmenting of clinicians.
Yeah, look, I think there's a big conversation that is happening, and it's already passed law in Illinois about how much can a purely AI platform do. Can it do therapy? Can it do this? Can it do that? And the answer is, I don't know if you guys have run into Steve Brown lately. I did an interview with him from a real OG from the Health Hero days, and he's got 25 different clinicians built on God knows how many LLMs playing a role and helping with his cancer. And
I think there's ethical issues
that is really, really clinical and maybe pretty good. So,
but I think there is ethical questions and training questions and change management questions that have to play a role here, because I can also tell you that I've had data at one of my jobs where when we enable clinicians with a highly qualified non-generative AI, they stop looking at stuff. They just stop clicking accept, accept, accept. So I think there's a balance there in terms of using it. Yeah,
I completely agree. We are as a society, let alone in healthcare. I mean, I know there's Chai and people trying to work on this, and a lot of smart people thinking about
and
this.
when we support that work, and we're part of that.
But as a society as a whole, we haven't got past we haven't looked over the parapet about what this is going to do to all kinds of things, and that's and crazily we're having stupid other. Let's not get into the politics of today. We're having a bunch of conversations that we shouldn't be having in order to, and we're not having that one, which really is probably the most important one for not only our generation but the people coming below us. But having said that, there is so much in the kind of administrative crap that, as you said, has a clinical impact. That yes, you could be super busy for the next 5 years just fixing God knows how many processes within health plans. And I don't know if you follow this. I'm doing one about Blue Shield and Brown and Toland paying or not paying LabCorp for my lab for me getting a $35 bill. And I'm into like hour 6 of like my conversation with them about trying to hunt down why is this being charged at this rate, and nobody knows. It's
what do you think the cost is to the payer for that entire direct?
Put it this way: if somebody gets the $35 out of me eventually, I don't think it's going to cover what it's.
That's exactly my point. That's what's happening. We have bulk and fat built into the system, which is driving the wrong incentives in terms of both payer and provider behavior. So I do think that you take the admin burden and you simplify it. Not only do you get care to patients in a direct way much sooner, but you also change some of the incentives that are driving the behavior.
Well, and it does give you a chance. I'm sure that.
And Matthew, I mean, it's going to be very interesting what we're going to see in healthcare in the next 2 to 3 years because of what's happening politically and at the administrative level, government-wise. It's going to take a while for the safety net and all the Medicaid erosion to sort of take place. And in my prediction at that point, when we see that nationally and individually in different states, because different states are going to respond in different ways, you're now going to see a big cost sharing, right? So it's all going to go to the folks that have commercial insurance, right? That need to sort of figure out how to keep safety net alive or keep people that are coming in off the streets, in some kind of emergency situation being hit by a car. Sure, CMS has got this sort of like interesting bill that they're trying to like buttress up some of the safety net. But I think what's going to happen is you're going to even have more downward pressure, right, on efficiency and operations. There's going to be more appetite for how can AI really sort of start solving some of the administrative burden. It's only going to get worse, particularly when, we just, I can't remember if it was an Aon report or a McKinsey report, but there was just singling that all of the employers and the brokers are getting hit with a pretty significant rise. Right. I mean, this is just going to go on. We're going to have more people uninsured, right? And so I mean, we've got the California Healthcare Foundation. They're one of our funders. They came in our early seed fund and they participated in the A. And their interest is the sort of AI divide between sort of the safety net and commercial healthcare. And I think this is something that is going to come up time and time again in the next 2 to 3 years as we see some of the decisions that are going to be played out from the policy side really take place in healthcare today. And there's only more opportunity for a company like PenguinAI and others that are going to try to solve some of this administrative burden, take some of this fat out, right?
Yeah, I mean, look, it's clear, you got to hope it's got to be done. But I think in the end, the admin, you're talking about the user experience being fixed, and there are 3 types of users, right? There's patients, there's clinicians and their staff, and then there's the poor people sitting in the call centers and on the doing and the poor person has to answer my call about the $36 to $34 charge or whatever. All of the above are none of them are having a good time, right?
Well, look, I look at our job as not just technology and not just the admin burden. I think those are the actual things we do. But if you ask me, what do we really do? We're trying to preserve dignity for people who are sick, right? Not put them through this process where even experts like you are frustrated with the system and spending, all you want is the care you deserve and your doctor has prescribed you and the insurance company has agreed to pay for. That's all you want. And so all this jumping of hoops through the middle is administration. And if there's one thing we can do to not just improve the patient experience, but to preserve human dignity, is to make that better.
So that's a great point to end on, I think. That is what we're trying to do, trying to improve human dignity, and hopefully we can do that with technology. So we've heard a really good argument from Penguin about why they need to be a platform play, why it can be used by both sides, why they believe that some of the people doing the point solutions will not be the interventional solutions. And it's going to be a fun time for the next few years for those of us cheering from the sidelines and enjoying to see how this actually all plays out. But let's hope, after all the money is spent and all the craziness that goes on at all the conferences and everything else, that we actually start to make a real difference in this. And I hope you guys are in the forefront. Brilliant. Well, I have been speaking with Fawad and Missy Krasner. They are respectively CEO and senior advisor, co-founder, some nebulous title that Missy's made up for herself at PenguinAI. Just had a $29 million Series A you heard about, and looking forward to seeing how you guys develop. Get announcing some clients, get showing me some technology. I look forward to catching up.
Thank you, Matthew.
Thank you. Such a pleasure as always.